There's a vitamin you've likely seen on shelves, maybe even in your own kitchen cabinet, that, when taken regularly by older adults, can increase the risk of stroke almost overnight. And it's not some obscure supplement. It's one of the most common vitamins marketed as essential for aging well. Here's the thing. While supplements can absolutely support health when used intentionally, certain nutrients, taken in the wrong dose, at the wrong time, or without understanding how they interact with your body, can do more harm than good. Especially as we age. Why this matters? As we move into our 50s, 60s, and beyond, the body becomes more sensitive to small biochemical shifts. The liver metabolizes differently. Blood vessels become more reactive. Hormonal balance changes. And our brain's response to blood flow, clotting factors, and even inflammation can radically shift. This is why understanding how vitamins interact with your cardiovascular and neurological systems isn't just trivia. It's survival. What this episode is really about. This isn't an anti-supplement rant. This is about nuance. Science-backed nuance. We're going to look closely at one specific vitamin, vitamin B6, and how excessive intake has been linked with a significantly increased risk of stroke in seniors. We'll walk through the mechanism behind this, what's happening in your blood, in your vessels, in your brain, and most importantly, what you can do about it. You'll learn why more is not always better when it comes to essential nutrients, the neurological risks of high-dose B6 and how it may lead to microvascular damage, how to audit your supplement stack safely, what healthy, evidence-based B6 intake looks like, tools to optimize your brain and heart health without falling into the megadose trap, and practical protocols for reducing your stroke risk through diet, timing, and behavior.
Stick with me because the research is compelling, the implications are serious, and the good news is, the fix is simple once you understand the root of the problem. This isn't fear-based health advice. This is clarity-based prevention. Key points outlined. 1. The hidden danger of excess B6 in seniors. 2. How B6 alters blood vessel function and clotting. 3. The problem with multivitamins, stacking without realizing. 4. What the research says, B6, neuropathy, and stroke risk. 5. How to correctly use B6 for cognitive and cardiovascular health. 6. A simple protocol to lower stroke risk starting today. Let's start with the core issue. Vitamin B6 toxicity isn't rare, especially in older adults. And yet very few people are even aware it's a problem. Here's what the research shows. In moderate doses, vitamin B6, also known as pyridoxine, is crucial. It helps regulate mood, supports neurotransmitter production like serotonin and dopamine, and plays a vital role in brain development and immune function. But there's a catch. Unlike water-soluble vitamins that the body flushes out easily when overconsumed, B6, especially in its synthetic supplemental forms, can accumulate in nerve tissues over time. And that accumulation isn't benign. In fact, a 2004 study published in the Journal of Neurology, Neurosurgery, and Psychiatry found that excessive intake of vitamin B6, above 100 milligrams per day, was associated with sensory neuropathy, a condition where people experience tingling, numbness, and in some cases, irreversible nerve damage. Other studies have linked prolonged B6 overuse with balance issues, muscle weakness, and coordination loss, all of which are high-stakes concerns for aging adults. And it gets more serious. In adults over 50, the blood-brain barrier becomes more permeable. That means substances that wouldn't normally reach delicate brain tissue can now cross over. Add to that the natural slowing of liver detox pathways and kidney filtration with age, and suddenly, the same dose that felt safe in your 40s can become toxic in your 60s or 70s. What's happening in your brain when this occurs? Excess B6 can interfere with the function of dorsal root ganglia, clusters of sensory neurons that carry signals from the limbs and spine to the brain. When these are overstimulated or damaged by prolonged high levels of B6, the brain receives faulty messages. You may feel numbness where there's no injury, or pain where there shouldn't be any, or, more dangerously, lose proprioception, your internal sense of balance and spatial awareness, leading to falls, missteps, and injuries. But here's the part that most supplement labels won't tell you. Many energy, or nerve support, formulas contain megadoses of B6, often 10 to 50 times the recommended daily amount. That's because B6 is marketed as a natural energy booster, or mood lifter. The problem is, there's a huge difference between correcting a deficiency and overshooting the mark. And here's a key point: the recommended dietary allowance, RDA, for B6 in adults over 50 is just 1.5 to 1.7 milligrams per day. Toxicity symptoms, according to multiple studies, can begin to show with prolonged use of doses above 100 milligrams, and some people are taking even more without knowing it. Have you checked your multivitamin lately? Your brain health capsule? Your protein powders? Most people don't realize they're stacking supplements. A multivitamin might give you 20 milligrams. Then a nerve support pill adds another 50. Then a smoothie powder adds 10. Over weeks or months, that adds up, and the effects don't announce themselves until damage is already done. So if you're someone in your 60s or 70s and you've been dealing with unexplained tingling, poor coordination, or balance issues, don't just chalk it up to aging. It could be your supplements working against you. The good news: this is preventable and reversible when caught early. The first step is awareness. The second is a simple audit of your supplements, which we'll walk through shortly. But first, in the next section, we'll break down how excess B6 affects blood vessels and stroke risk specifically, and why seniors are uniquely vulnerable to this hidden mechanism. If this insight is helping you, consider subscribing. We break down science like this every week, and there's much more coming your way. Let's connect the dots. How does a vitamin, something meant to protect your brain and body, contribute to stroke risk? The answer lies in your blood chemistry. Specifically, in how vitamin B6 interacts with an amino acid called homocysteine. Here's what the research shows. Under normal conditions, your body uses B6, along with B12 and folate, to convert homocysteine into methionine, an amino acid used for repairing tissue and producing essential molecules. But when you have too much or imbalanced B6, this conversion process can get disrupted. And that's a problem. Because elevated homocysteine levels are directly linked to increased risk of stroke, especially in adults over the age of 50. In a large-scale study published in Stroke, the Journal of the American Heart Association, researchers found that older adults with high homocysteine had significantly higher odds of ischemic stroke, the kind caused by clots blocking blood flow to the brain. That's the most common type of stroke, and it often strikes without warning. But here's where it gets more nuanced. You don't need to be deficient in B6 for this to happen. You can actually have excess B6 and still disrupt the homocysteine pathway, especially if B12 or folate aren't in balance. In other words, it's not just about how much of one vitamin you take, but how they work together. Imagine your blood vessels as flexible, responsive tubes. When homocysteine builds up in your bloodstream, it acts like a slow, corrosive acid. It weakens the inner lining of those vessels, what scientists call the endothelium. Once that lining is damaged, your body starts patching it with cholesterol and clotting factors. Over time, this leads to plaque formation, inflammation, and a higher chance that a clot will form and lodge in a cerebral artery, causing a stroke. Now, here's where B6 overdose adds fuel to the fire. Too much B6, especially in synthetic supplement form, can alter platelet function and disrupt nitric oxide signaling, both of which are critical for proper blood flow. Nitric oxide helps relax blood vessels and prevent clotting. When the system goes out of balance, the blood can become stickier, more prone to clotting at the wrong time, in the wrong place. Have you ever had a leg cramp or felt unusually cold in your fingers or toes? These might not just be aging symptoms. They can be signs that microcirculation, the small vessel blood flow, is being impaired. And here's the kicker: stroke risk doesn't build slowly in every case. In some individuals with high homocysteine and vessel inflammation, a single trigger, like dehydration, poor sleep, or extreme stress, can set off a cascade that ends in a clot. That's why this matters, especially for seniors. As we age, vessel elasticity declines, clotting risk increases, and the margin for error gets smaller. A supplement habit that felt safe in your 40s can become dangerous in your 70s, especially if it's not being checked by a physician or tested with blood work. So what can you do? Start by asking, when was the last time you had your homocysteine levels checked? Do your supplements list the specific form and dose of B6? Are you balancing B6 with B12 and folate, ideally from food or methylated forms? A simple tool to apply is this: track your daily B6 intake across all sources for 1 week. Add it up. Then compare that number to the safe upper intake level, which for adults is 100 mg per day, and ideally, for most people, it should be far less. If you're stacking multiple supplements, you might be well above that without knowing. And if this kind of deep dive into brain and body health resonates with you, tap the subscribe button. We're building a community focused on clarity, not fear, evidence, not trends, and your journey to long-term health deserves nothing less. Next up, how multivitamins might be stacking your B6 intake without you realizing it. Let's step into your morning routine. You wake up. Maybe stretch, hydrate, grab a small breakfast, and take a multivitamin. Seems harmless, even smart. Then later in the day, maybe you take something for energy, or joint support, or brain health. A protein shake, a sleep capsule. You're health conscious, doing what you think is right. But what most people don't realize is that these supplements often overlap in ingredients, especially with vitamin B6. And that overlap can lead to something I call accidental megadosing. Here's the issue: supplements don't talk to each other. But your body has to deal with all of them at once. A typical senior multivitamin might contain 20 to 25 milligrams of B6, which is already 15 times the recommended daily amount for someone over 50. Add a nerve support capsule and that might jump to 50 milligrams more. A protein blend? Another 10 milligrams. Suddenly, without even noticing, you've hit 80 or 90 milligrams of B6, just for existing. And most labels won't flag this as a risk. In fact, many brands promote high-potency vitamins like a badge of honor, especially for aging adults. The idea is, if a little helps, more must help more. But biology doesn't work that way, especially when it comes to the nervous system. A 2017 study published in Neurology Clinical Practice analyzed adults taking over-the-counter B6 and found that symptoms of nerve toxicity, including tingling, numbness, and balance problems, occurred even in people taking just 50 milligrams per day. That's half the upper, safe, limit, and it only took a few weeks in some cases for symptoms to show. And here's a real-world scenario that happens all the time. Someone starts feeling low energy. They take a B-complex or multivitamin. They develop slight numbness in their fingers or feet. They assume it's age-related neuropathy. To fix that, they add a nerve support formula, often with more B6. Symptoms worsen. They switch brands, try different support products, not realizing they're increasing their B6 exposure each time. By the time they connect the dots, the damage is done, and in some cases, it's not reversible. So what can you do? First, audit your stack. Look at every supplement you take, not just your main multivitamin, but sleep aids, protein powders, stress formulas, even energy drinks or bars. Write down the B6 amount from each. Then total it. If you're getting more than 10 to 20 milligrams per day consistently, that's a red flag. Unless you have a medically diagnosed deficiency, which is rare, you don't need high doses, and certainly not in isolation. Second, check the form. B6 comes in different types: pyridoxine hydrochloride, synthetic pyridoxal 5-phosphate, active form, and others. The synthetic forms are more likely to cause toxicity because they rely on liver conversion. The active form, in lower doses, is generally better tolerated. And third, talk to your doctor about getting your B6 and homocysteine levels tested, especially if you're experiencing any neurological symptoms or taking multiple supplements. A tool you can apply today. Download a simple supplement tracker or use a Notes app. Create a section for daily dose, and log your intake for 7 days. Anything above 50 milligrams of B6? Reevaluate or consult a nutritionist. And this isn't about fear. It's about clarity. Your health habits should support you, not silently sabotage you. That's the power of understanding how your stack works together, not just in parts. We're halfway through this breakdown, and up next, we'll get into the clinical research connecting high-dose B6 to increase stroke and neuropathy risk, and how to reverse course. Everything we've covered so far, about excess B6, nerve damage, and stroke risk, is grounded in clinical data. And when you look at the literature, the pattern is hard to ignore. In one of the most referenced reports, published in Neurology, 1987, researchers followed patients who were experiencing unexplained nerve damage. The common thread? They were taking high doses of vitamin B6, some as low as 50 milligrams per day, others closer to 200 milligrams daily. The longer the exposure, the more severe the symptoms became: numbness, poor coordination, burning sensations in hands and feet, and in some cases, difficulty walking. These weren't rare cases. They weren't genetic outliers. They were adults, mostly middle-aged and older, taking over-the-counter supplements that were supposed to help their energy, mood, or nerves. The study concluded that B6-induced neuropathy was dose-dependent and reversible in early stages, but could become permanent if exposure continued. Now let's bring it closer to the present. A 2014 cohort study published in Stroke, the Journal of the American Heart Association, looked at vitamin levels and stroke risk in older adults. One of the key findings was that participants with elevated B6 intake from supplements, not food, had no protective effect against stroke, and in some subgroups, showed slightly elevated stroke risk when combined with poor B12 or folate levels. Why does that matter? Because many older adults are mildly deficient in B12 due to decreased stomach acid production. That means even if your B6 levels are technically normal, the balance is off, and that imbalance disrupts how your body clears homocysteine, how your vessels respond to inflammation, and how your nervous system processes stress. It's not just about too much B6. It's about how B6 interacts with the rest of your biology, and how supplement marketing often ignores that complexity. Let me give you a real example. A 72-year-old woman developed severe peripheral neuropathy. She was an active walker, sharp-minded, healthy weight. But over several months, she began losing feeling in her legs and couldn't walk without support. Her labs showed B6 levels 5 times the normal upper limit. Why? She was unknowingly stacking supplements, a multivitamin, a protein drink, and a nerve support formula. All told, she was getting over 250 milligrams per day. Her doctors advised stopping all supplements. Within weeks, sensation began to return. Within months, she regained full mobility. Now, not everyone will have that kind of response. Some people metabolize B6 faster. Others are more sensitive. But the science is clear. When taken in excess, vitamin B6 can cross from helpful into harmful, especially for the aging brain and vascular system. So how do you apply this knowledge? First, understand that more is not better, even for essential nutrients. Vitamins follow a U-shaped curve. Too little is dangerous, but so is too much. Optimal is somewhere in the middle, and that's where most people should aim. Second, if you've been experiencing numbness or tingling, balance problems, strange burning sensations in your hands or feet, or sudden fatigue that doesn't match your lifestyle, it's worth checking your B6 levels with a blood test. And third, don't rely on symptoms alone. B6 toxicity can build quietly. Regular intake over the upper limit, even 50 to 100 milligrams per day, over months or years can slowly chip away at nerve integrity. The damage isn't loud until it is. If this type of research-based breakdown is helping you navigate your health more confidently, give this video a like, and share it with someone who might be stacking supplements without realizing it. It might just prevent a serious complication. Because here's the truth, vitamin B6 is essential. Your body needs it for over 100 enzyme reactions, from neurotransmitter production to immune response to blood sugar regulation. The goal isn't to avoid B6, it's to use it wisely, intentionally, and in balance with the rest of your biology. Let's start with what optimal actually looks like. The recommended dietary allowance, RDA, for B6 in adults over 50 is 1.5 milligrams per day for women, 1.7 milligrams per day for men. That's it. Those are the targets needed to support healthy metabolism, brain function, and cardiovascular health. Not 25 milligrams. Not 100 milligrams. Just a couple of milligrams, easily reached through food. In fact, you can hit that target with a simple, whole food diet. A cup of cooked chickpeas, for example, provides about 1.1 milligrams of B6. Add in some salmon, a banana, and a handful of pistachios and you're well within optimal range, no pills required. So when does supplementation make sense? There are a few evidence-based use cases. People with diagnosed B6 deficiency, rare, but possible in alcoholics, individuals with kidney disease, or on certain medications like isoniazid or hydralazine. Those with genetically elevated homocysteine levels who aren't responding to B12 and folate alone. Individuals with specific neurological conditions where B6 metabolism is impaired. But even then, the goal isn't high doses, it's targeted, well-monitored support. For example, using P5P, pyridoxal 5-phosphate, the bioactive form of B6, in low doses, around 5 to 10 milligrams per day, can offer therapeutic benefits with lower toxicity risk. A good rule of thumb: if you're supplementing B6 without a confirmed medical reason, and especially if you're also taking a multivitamin, you should stop and reassess. And here's an easy protocol you can apply this week. The B6 Rebalance Protocol. 1. Track your total daily intake from all supplements and fortified foods for 3 days. 2. Compare your total to the safe upper limit, 100 mg per day, but aim for under 20 mg. 3. Pause all non-essential supplements containing B6 for 1 week. 4. Switch to food-first sources. The examples above are a great starting point. 5. Reintroduce supplements only if needed, and preferably under the guidance of a functional medicine doctor or registered dietitian. This isn't just about safety, it's about strategy. Supporting your brain and blood vessels long-term means honoring how your body processes nutrients as it ages. The liver slows down. Your filtration capacity declines. The room for error gets smaller. So the smartest move isn't more, it's precise. And if you're wondering whether your cognitive function will suffer without high-dose B6, the answer is no. In fact, keeping your intake in balance supports more stable neurotransmitter production, better sleep quality, and reduced vascular inflammation. All protective against the brain fog, mood swings, and fatigue many people blame on just getting older. The science is clear: using B6 intentionally, in its right form and right amount, supports optimal aging. Abusing it, even accidentally, does the opposite. In our next section, I'll walk you through a simple, science-based stroke prevention protocol, focused on daily habits, not just supplements, to give your brain and heart the best chance of long-term resilience. At this point, we've covered the risks of excess B6, how it affects your nerves and blood vessels, and how to use it safely. Now let's zoom out and build a simple, practical protocol, one that doesn't just reduce B6 toxicity risk, but actively protects your brain and cardiovascular system. This protocol isn't complicated. It's built on 3 principles. 1. Eliminate unnecessary inputs. 2. Balance nutrient interactions. 3. Support vessel health through daily behavior. Let's walk through each one, step by step. Step 1. Audit and eliminate. First, go through everything you ingest, not just your vitamins, but also energy drinks, protein powders, meal replacement shakes, brain boosters, and sleep aids. Most people are surprised to find multiple sources of B6 in these products. Create a basic intake table. Supplement/food name. B6 amount in mg. Frequency, daily/weekly. Total it up. If you're above 20 mg per day consistently and not being monitored by a professional, it's time to simplify. Here's your rule: no stacking without intention. You should never be getting B6 from 3 or 4 different sources unless there's a clinical reason and a blood test confirming the need. Step 2. Rebalance with B12 and folate. If B6 is part of your health strategy, it needs to live in harmony with B12 and folate, the other key players in the homocysteine cycle. Low B12, which is common in people over 60 due to reduced stomach acid, can leave homocysteine levels dangerously high even if your B6 is within range. Solution? Include B12-rich foods like eggs, sardines, beef liver, or fortified nutritional yeast. Include natural folate sources like leafy greens, lentils, and asparagus. If supplementing, aim for methylated forms, methylcobalamin for B12, methylfolate for better absorption. Ask your doctor for a homocysteine blood test. It's inexpensive, and it tells you more about your real stroke risk than total cholesterol. Step 3. Build brain protective habits. Stroke prevention isn't just about supplements, it's about lifestyle consistency. Here are evidence-based habits you can start today. Walk 20 to 30 minutes daily. This boosts cerebral blood flow, reduces vascular stiffness, and supports overall heart-brain connection. Sleep 7 to 9 hours consistently. Poor sleep increases inflammation and clotting risk. Even one bad night can spike blood pressure and affect brain perfusion. Stay hydrated. Dehydration thickens your blood. Seniors are especially vulnerable to this. A general guideline: aim for at least 6 to 8 cups of water daily, unless contraindicated. Limit sodium to under 2,300 milligrams per day. High salt intake stiffens arteries over time. Cook at home more. Avoid processed foods. Your brain will thank you. Practice daily breath work or stress reduction. Studies show that even 5 minutes of slow, nasal breathing or mindfulness practice can lower systolic blood pressure and reduce stroke risk. And finally, if you're on medications like blood thinners, blood pressure meds, or statins, talk to your physician before adding any supplement, including B6. Drug-nutrient interactions are real, and your body isn't a guessing game. Final takeaway. You don't need megadoses of anything to age well. You need precision, consistency, and respect for your changing physiology. Here's a simple mantra to guide you. Measure what matters. Keep what's necessary. Remove what's not. This stroke prevention protocol is easy to follow, but powerful in effect, because it's based on how your biology actually works, not trends or marketing. And if you've made it this far, you're clearly someone who values evidence-based, thoughtful health insights. So here's your next step. Hit the like button if this helped you. Subscribe if you want science-based tools for optimizing your brain, body, and behavior every week. Drop a comment if you've had experiences with supplements, or questions you'd like us to break down next. We're building a smarter, stronger community here, and you're part of it. Let's zoom out and pull the whole picture into focus. We've been conditioned to believe that vitamins are inherently safe. That more is better. That if something helps a little, a lot must help a lot. But the truth, especially when it comes to the aging brain and cardiovascular system, is far more nuanced. Vitamin B6 isn't dangerous in and of itself. In the right amounts, it's essential. It supports neurotransmitter production, helps regulate mood and energy, and assists in converting homocysteine, a stroke-linked compound, into more harmless forms. But here's the core issue: most people don't know how much they're actually taking. They stack a multivitamin with a nerve support formula, add in a protein powder, maybe a pre-workout or sleep aid, and before they know it, they're getting 5, 10, even 20 times the recommended amount of B6. Every single day. For weeks. For months. And the effects don't show up with a bang. They creep in. A little tingling in the feet. A sense of imbalance. Fatigue. Coordination issues. And often, by the time symptoms become clear, the damage is already in motion. What the science shows, and what you now understand, is that chronic excess B6 can lead to peripheral neuropathy, impaired blood vessel function, elevated homocysteine, increased risk of ischemic stroke in older adults. But here's the good news: this is entirely avoidable. And even better, it's fixable. Let's recap what to do. 1. Audit your supplements. Know exactly how much B6 you're getting daily. Eliminate accidental stacking. 2. Aim for food-first nutrition. Salmon, bananas, spinach, and sunflower seeds give you all the B6 you need, with none of the toxicity risk. 3. Balance with B12 and folate. These nutrients work together, especially in homocysteine metabolism. One out of sync throws off the rest. 4. Track your homocysteine levels. It's a powerful predictor of stroke risk, and one of the most overlooked. 5. Adopt low-friction habits that protect your brain and blood vessels. Hydration. Walking. Deep sleep. Slow breathing. These aren't just nice ideas, they are protective protocols. But more than any single step, what this episode is really about is awareness. Because here's what no supplement company will say on the label. Your body changes with age. Your response to nutrients changes. Your margin for error shrinks. And that means the only smart strategy is precision, not guesswork. So here's your challenge for today. Open your cabinet. Pull out every supplement you take. Look at the label. Find the B6 number. Write it down. Total it. Then ask yourself, is this aligned with what I now know? Am I doing this with intention, or by habit? Is this helping, or is it just health theater? One small audit can save you months, even years, of complications. And if you found this helpful, here's how to stay plugged in. Like this video if you learned something new. Subscribe to get grounded, practical, science-backed tools every single week. Share this with someone in their 50s, 60s, or 70s who's trying to take care of their health. They might be silently stacking without knowing it. Our goal isn't to fear supplements, it's to understand them. And when you understand what your brain and body actually need, you start making choices from a place of clarity, not confusion. This channel is here to help you do that, week by week, insight by insight. Take care of your brain. Take care of your blood. And always question what you're told, even when it comes in a bottle labeled healthy. We'll see you in the next one. Subscribe.